Good evening, everyone. Welcome to Pediatrics by Dr. Anand. I hope my voice is audible to everyone. Please let me know in the comment section. Hello, amazing people. How's everyone doing? Good evening, everyone. My name is Dr. Anand, and today we are here. A beautiful day today. Today we are here to talk about the FMG recall questions 2023 for the FMG paper. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Thank you so much. Good evening to all the amazing people. I hope my voice is audible. Hello, Sarthak. Hello, Julie. Hello, Shubhangi, Osama, Swaraj, Suman. We have Priya Gupta. We have Moni Mala. We have all the amazing people. We are there in the participants for our classes. I hope my voice is audible to everyone. My name is Dr. Anand, and today we are here to talk about the 2023 this year FMG recall questions. Most importantly, we're gonna talk about 2023. This time we had the questions, recall question. We're gonna talk about them. Most importantly, please note these are the amazing recall questions. So not like a copy paste question. I don't have. It's just like the assumptions of the questions which had come in the exam, and so we can talk about them. We can share some good amount of knowledge, and also we can enrich our knowledge. Is my voice audible to everyone? Please put a message in the comment section. Thank you so much, everyone. I hope my voice is audible. This time, FMG paper was good, like pediatrics question. If I talk about pediatrics per se, the questions were nice, they were comfortable enough, but it's good that we have a quick revision on this amazing questions. Before starting any amazing segment, we always have a motivating quote, and today's amazing motivating quote will be, yes, okay, let me say hi to all. Hello, Dr. Barad. Hello, Julie. Hello, Shashi Bhushan. Hello, Sarthak. Anand sir, we like, when will the session start? Yeah, exactly. So let's start. Let's share some good knowledge. Before starting an amazing segment, we always have a quick motivating quote, and today's beautiful quote will be this. Scar tissue. Scar tissue is stronger than the regular tissue. Realize the strength and move on, guys. Next 30 minutes, I want you guys to pay full amazing crazy attention for this class right now, because we're going to talk about a lot of amazing stuff in this class. So as I say, very important, this quick motivating quote which says scar tissue is stronger than the regular tissue. Realize the strength and move on. So whenever problems come in your life, don't say why me, say try me. You are amazing. Tell yourself you are a beautiful soul. Tell yourself you are amazing. Tell yourself if there are problems in your life, you will become stronger, you'll become mature, you'll become more wise by time. Okay, so let it come, anything or everything, and everything will make sense by the end of the journey. And very importantly, please remember, as these questions are clinical oriented these days, so remember, hard work and smart work, there's a very thin line between the hard work and smart work. So study the way you want to study, do the hard work the way you want to do. Make a schedule, do everything in your life. I'm telling you, the smart is the one who utilizes the whole day in a very beautiful way. Not only studying, not only watching Netflix, dividing the time and doing everything possible. Let's start this class, guys. A post-term neonate. So these are very good questions this time in FMG. Some were tongue twisting questions, some were literally to the point questions. A post-term neonate is defined as born more than how many weeks? Can you please answer in the comment, please? What is preterm, term, and post-term pregnancy? As we all know very beautifully, yeah, so more than 42 weeker. Yes, very beautifully told by Shubhangi Osama. Yes, Shubham, you're right. Very good. Dr. Sarthak Praharaj, one of my very close friend and very good junior. So we all know that post-term neonate is nothing but born more than 42 weeker. And can you please answer in the comment section, what is a preterm neonate? Preterm is the one who is born less than 37 week. Yes, that's right. So less than 37 weeker will be a preterm. More than 42 weeker will be a post-term baby. And 37 to 41 completed weeks is nothing but very important, term pregnancy. Yes, that's right, term pregnancy. Beautiful, amazingly told by Vijeta, Priya Gupta, Osama, Alfaz Menon, Anu Komar, Barad, Julie. So many people today. Very good. Next question, please. Which vitamin is responsible for the collagen formation and or collagen defect? Now these, listen to me very carefully, utilize this every bloody second of this class. Okay, try to look at the questions and try to solve them in a way that you're reading this for the first and last time, and this has been beautifully imprinted in your mind, the knowledge which I'm sharing. Okay, Perfect. Yes, Shubhangi and Osama, one of my favorite juniors, you're right. Which vitamin is responsible for the collagen formation and or collagen defect? So in our previous classes, in our electrolyte and imbalances classes, we have done vitamin C plays a very important role for the bone formation, for antioxidant properties, for healing therapy. We use vitamin C. So vitamin C, yes, undoubtedly, if you attended my musculoskeletal, classes, there, this was the slide I have told about the functions of vitamin C, and the first basic function of vitamin C is nothing but very, very important: collagen formation, good bone formation, collagen formation. Very true. Yes, yeah, you're right, Dr. Sarthak. Very good. So the various beautiful functions of vitamin C are: number one, collagen formation. Very importantly, it helps in the formation of chondroitin sulfate. Please remember even this also. Many companies, they have this tablets, chondroitin sulfate, 600 milligram, joint health, joint mobility, tissue elasticity, 120 capsules. So like that's what chondroitin, collagen, all these things are good of functions of vitamin C. And also it has a beautiful role in the wound healing, and also very nice that vitamin C helps in conversion of folic acid from one form to the another. And as vitamin C plays a very important role, if I don't have vitamin C in my body, the conversion of folic acid from one form to another will not take place. If it will not take place, then definitely vitamin C deficiency can lead to megaloblastic anemia. Megaloblastic anemia, very, very important. And that's what in megaloblastic anemia picture, definitely you will see a macrocytic hypochromic anemia. Beautiful. Amazingly told by Sarthak Praharaj. Sarthak Praharaj says vitamin C is responsible for hydroxylation of proline and lysine residues. Yes, 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 my cute brother. Very good. Very right. Brave. Perfect. So very beautifully told by all the amazing students. And also vitamin C helps in the increased absorption of iron. Now coming to the next question. A 10-year-old male child with fever, irritability, and meningeal signs. His CSF picture had low sugar and high protein with lymphocytic predominance. What is your best diagnosis? Please note, these are the recall questions, dude. So we're gonna cover like everything about associated with that question. So what do you think, my dear Dr. Barad, Dr. Raj, Dr. Sarthak Parharaj, Osama, Kritika, Giriya, and Anu Komar? Beautiful. So 10-year-old male childhood with fever, irritability, and meningeal signs. Fever, irritability, and meningeal signs. Okay, so this looks someone having fever, someone who's very irritable, and having meningeal signs. So I think this case is a case of meningitis. Of course, someone having meningeal signs positive will be a meningitis. Someone having altered sensorium will be a encephalitis. Someone having meningeal signs plus altered sensorium will be meningoencephalitis. Okay, his CSF picture had a low sugar and high protein with lymphocytic predominant. This time the question was literally to the point. I have told in multiple time in my neuro classes in TBM, we have beautifully told low sugar, high protein, lymphocytic predominant. जो ये टीबी वाला वो क्या बोलते हैं बैक्टीरिया होता है, वो शुगर को खा जाता है, ठीक है, और फिर ताकतवर हो जाता है. He eats the sugar and becomes good. So low sugar and high protein and lymphocytic predominant, very important. So very beautifully the answer will be tubercular meningitis. Tubercular meningitis. Yes, Julie has told the right answer. Priya Gupta, one of our very good student, Priya Gupta says viral meningitis. Yes, exactly. So, Dr. Priya, viral meningitis picture will be number one. It'll have a short history. Viral meningitis picture will have a very short history, and even though the short history or long history has not written over here, but viral meningitis will not have this CSF picture. Let me show you the multiple CSF picture, a very, very important picture of bacterial meningitis, viral meningitis, and TB meningitis. Now, very, very important, when I suspect meningitis in a patient, I do the lumbar puncture and do the cerebrospinal fluid analysis, CSF analysis we do to look for the various cause of the meningitis. Whenever I take a CSF sample, very importantly, I check for the pressure. Most importantly, yes. Now, please look at these points: protein, sugar, and lymphocytes. Very, very important. This is what I usually see is about protein is how much, glucose is how much, is it polymorph predominant or lymphocytic predominant? Now, listen very carefully. In our hospital also, whenever we do a CSF, low sugar, high protein with the lymphocytic predominant will be a tubercular meningitis. Low sugar, high protein with polymorph predominant will be a bacterial meningitis. Please remember, my dear, imprint this in your 250-gram brains that low sugar and high protein with lymphocytic predominant will be a tubercular meningitis. Low sugar and high protein with polymorph neutrophils predominant definitely will be a bacterial meningitis. Bacterial meningitis. Whereas, as per Dr. Priya Gupta said, viral meningitis, you don't have a low sugar. Either the sugar will be normal or high. Either the sugar will be normal or high. Dr. Priya Gupta, are you able to understand? So what we understood in this slide I have understood, if any patient comes with meningitis, then of course CSF analysis is important. If someone having a low sugar and high protein with lymphocytic predominant will be a tubercular meningitis, and low sugar and high protein with polymorphly predominant will be a bacterial meningitis. Whereas in a case of will be a very, we have seen a lot of viral meningitis patient, very short history. 3 days of fever with altered sensorium, 3 days my patient is on ventilator and all that. Very short history usually viral meningitis patient has, and usually they are like normal to high sugar. They don't have a low sugar. Remember that, okay? Yes, exactly. Dr. Sarthak Praharaj says, this was a little catch. Was a good word which I liked it. Has everyone understood this much? Yes or yes, please put a message in the comment section. Okay. सबको समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? अगर दिमाग के ऊपर से जा रहा है तो आई रिकमेंड यू शुड टेक 5 almonds, 1 spoon of honey and 1 spoon of chawanprash. It's good for skin also, actually very nice. Dr. Shubham, how are you, brother? Dr. Julie, Dr. Priya, Shubhangi, one of my favorite, Junior Osama, Sara, Ahana, Alfas, Menon and Anu. Lot of students we have, actually new names also. Okay, perfect. Let's continue further. Whatever you're studying in this class, please remember you're studying this for the first and last time. Like imagine that way and just finish the whole book. Okay, finish it. Okay, now tell me, identify the image. I'm gonna show you the options now, but could you please, by looking at this beautiful rubbery benign small thing, what do you think these things are? Dr. Surat Suman Shri Anukumar Sarthak Praharaj says definitely hemangioma. That's very well put. What is this, dear? What is this thing? Definitely this also very true. Dr. Shubham, very good, dear. This looks like a hemangioma. I'll show you one more picture. This also, identify the image, was a question for 2023 recall. That what is this beautiful picture? Is this a Mongolian spot? Is this amelia? Is this a harlequin color change, hemangioma or cavernous hemangioma? Like I intentionally put 5 options. I felt like putting 10 options actually. It's a recall. With recall, I want you to learn more and more. Okay, don't stop at one place. Okay, life is beautiful. Please remember that. Okay. Sorry for the overexcitement. I just came back from gym and today was thighs with little abs workout, and that's why I was a little late today. I apologize for being late. Yes, exactly. So, bro, why this doesn't look like a Mongolian spot? Can anyone answer in the comment, please? Why this doesn't look like a Mongolian spot? मेरे को तो Mongolian लग रहा है. क्या आपको Mongolian लग रहा है? क्या आपके toothpaste में नमक है? So this is not a Mongolian spot, dude. Mongolian spot is this. This is my patient only, actually. So this bluish patch, basically, the most commonest location of a Mongolian spot is lumbosacral region. So this one, dear, these bluish patches, no, bro, that is Mongolian spot. Okay, this is a Mongolian spot. One of the normal findings, like one of the findings in a newborn baby, which looks abnormal but is a normal. So this, like this one, this does not look like a Mongolian spot to me. Done. Okay, next, this is melia. Is this looking like a melia? What is this? This is a beautiful picture. Beautiful. In our neonatology classes, 1000 times we have discussed this. Keratin deposition beneath the skin. Very important. Remember, keratin deposition beneath the skin. That is nothing but melia. Okay, melia, keratin deposition beneath the skin. Very important. True. Dr. Swaraj Suman, very true. Manoj Chaudhary, we have Asna, Ahana, Shri and Priya Gupta. Perfect. Very good. So this is a melia. This picture, actually, it is a melia. So that is why if I go back to my MCQ, dear, so this does not look like a melia. Harlequin color change. Is this looking like a harlequin color change? Dr. Sarthak Praharaj, could you please mention in the comment, is this look like a harlequin color change? I'm sorry, this doesn't look like a harlequin color change. This is the harlequin color change. Very important. This is a harlequin color change. Please remember that. Where one half of the body is red and one half of the body is pale. So this is nothing but harlequin color change. Please remember. Very good, Shubhangi. Shubhangi is now one of our very integral part of pediatrics by Dr. Anand. She's helping me a lot. She's helping me a lot. And Osama to hai hi hamesha. So I'll repeat again. What did we understand in this picture? In this picture, I have understood this actually looks like a hemangioma, not a cavernous hemangioma. They are cavernous hemangiomas are more towards the viscera. This basically a benign condition which can be over the face, can be like this, or can be like this. This is a very classical picture of hemangioma, infantile hemangioma or just hemangioma. What is the treatment for hemangioma? There is no treatment required actually. It is, you don't, there's no need for taking any laser therapy is not required unless it is obstructing my eye or obstructing my ears or obstructing my nose. So if it's obstructing some important organ or part of the body, then of course you can do for the dermatological opinion. Otherwise, there is no need of doing anything for this. In our YouTube channel, we have made a proper 2 minutes video on hemangioma by Dr. Anand. Later you watch on YouTube, very beautifully I have told this with this rubbery benign conditions, why they happen, what's the treatment, very beautifully I have explained. But this right now I have to say to the point. In this beautiful class, I have understood this looks like a milia, this looks like a Mongolian spot, this looks like a Harlequin color change, very, very important, and that's it. Next question. Breastfeeding should be started within in how many hours of life? Very straightforward question. This time FMG 2023, luckily you should be very happy. These are like literally very good questions, and it's as in like very simple. That is why I always say that minor subjects must be thoroughly finished because they can fetch you very good marks. There are some 20 to 30 questions which came of pediatrics, and many questions are parallel to even medicine. So breastfeeding should be started in how many hours? Very beautifully, immediately by Dr. Julie says, Dr. Shubhangi says A. Beautifully told by Asna, Shri, Barad, Osama Sheikh, Dr. Anum, Vijeta, Chaturvedani, and Dr. Shubham, one of my very, very good brothers. That's very well put. Beautiful. Breastfeeding should be started within how many hours of life? 1 hour of life should be started. Very well said. Okay, can you please tell me when do you celebrate breastfeeding week? Can you please answer in the comment? When do you celebrate breastfeeding week? A quick question, please. Yes, Dr. Suman. Yeah, Dr. Suman says 30 minutes to 1 hour. So just remember that's what beautiful. As Dr. Sarthak is very well says, like ASAP, as soon as possible, dude. If it was the option were 30 minutes and 1 hour, I should have chosen 30 minutes. If the question was ASAP and 30 minutes, I should have chosen ASAP as soon as possible. That's what, yeah, exactly. So who told this answer? Dr. Julie has told a very beautiful answer. First week of August. That's very well put. First week of August, you celebrate breastfeeding week. That's true. That's true. And word rabies day, I forgot. Can you please revise 10 more days right away? When do you celebrate world rabies day? Could you answer in the comment, please? Yes. Who will tell? 10 रुपए मिलेंगे, 10 रुपए, 10 का दो, 10 का दो, 10 का दो, 10 का दो. Yeah, that's right. So rabies day celebrate on 28th of September. 28th of September. When do you celebrate World Environment Day? Quick answer, please. Can you please finish this? World Environment Day. World Environment Day. कोई बताएगा? कौन बताएगा बिना मार खाए? Very cute, very nice. 5th June. 5th June we celebrate World Environment Day. Very good. Doctor's Day. Doctor's Day. Doctor's Day. Who will tell? Quick answer, please. Quick answer. Before I kill you with my gun, could you please answer in the comment? Yes, you're right. Shubhangi, Priya, Barad, मनोज चौधरी, जूली, शुभम, 10 का दो. हाँ, तू कर मजाक कर बेटा, तू बाहर में तेरे मारता हूँ मैं शुभम. डॉक्टर्स डे वी सेलिब्रेट ऑन 1 जुलाई. डॉक्टर्स डे वी सेलिब्रेट ऑन 1 जुलाई. अच्छा, और क्या है? और वर्ल्ड एनवायरमेंट डे हो गया. लास्ट क्वेश्चन, दिस वन. Word Malaria Day. Word Malaria Day. Can you please answer in the comment? Word Malaria. Sarthak, your answers are not coming. Please, before I block you on WhatsApp, could you please answer? Osama is right. Malaria Day we celebrate on 25th of April. That's right. So can we please have a quick revision? The quick revision is Doctor's Day we celebrate on 1st July. World Environment Day 5th June. Breastfeeding first week of August. Rabies Day 28th September. And World Malaria Day. Zero malaria ends by me. The theme was for 25th of April. 25th of April. Let's have a very quick revision of what we have spoken on this planet. In this planet, we have beautifully spoken. Question number 1 was postterm neonate is defined as. The answer was a baby who has more than 42 weeks is a postterm baby. Next question was which vitamin was responsible for the collagen formation or collagen defect? Collagen. Undoubtedly, it is vitamin C. The next question we understood was this one, a 10-year-old male child with fever, irritability, and meningeal signs. Fever, irritability, and meningeal signs, typically a case of meningitis. CSF showed low sugar, high protein, lymphocytic predominant. Without any doubt, you should choose tubercular meningitis. If it was low sugar, high protein, polymorph predominant, then it was more of a, very importantly, bacterial meningitis. Remember that. This part is done. Then also we understood this was a case of hemangioma, which we have covered, which you don't have to do anything for that unless it is obstructing your eye or obstructing your nose or any part of the body. Then also I understood this was something known as melia. This was lumbosacral region, bluish patch pigmentation, that is nothing but a Mongolian spot which can fade away by 1 year of life. Then also I understood something known as harlequin color change, where the one part of the body was red and one part of the body was pale. Please note, this is normal. This is normal. This is normal. This is normal. Remember, okay, it is not an abnormality. It is normal condition. Then also we understood various days, and also I got the knowledge that breastfeeding should be started within how many hours of life? The answer is as soon as possible. Has everyone understood this much? Yes or yes, yes. Please put a like button और like, share and subscribe. मुझे वोट करने के लिए मेरी लाइंस आज रात को 10 बजे तक खुली हैं. समझ में आया या दिमाग के ऊपर से गया? टेल मी यस और यस यस. ओह देखो देखो कौन आया. डॉक्टर आशुतोष हैज कम, वन ऑफ माय वेरी 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 जेन्युइन फॉलोवर. ओके. सब गाते हैं, सब ही मदहोश है. Yes, the next question. See, listen to me very carefully, bro. Last 3 year question papers, मैं जन्मों जन्मांतर से कह रहा हूँ कि भैया last 3 year question paper solve कर लेना. Multiple questions, multiple topics have been repeated. विटामिन ए डेफिशिएंसी से हमेशा क्वेश्चन आता है, इस बार भी आया था. सैम से हमेशा क्वेश्चन आता है, इस बार भी आया था. ब्रेस्ट फीडिंग से हमेशा क्वेश्चन आता है, इस बार भी आया था. रीन किडनी से हमेशा 1 से 2 क्वेश्चन आते हैं, 2 क्वेश्चन आए थे. तो बहुत सारे क्वेश्चन रिपीट हुए थे मरने से पहले. आई रिकमेंड यू शुड सॉल्व देम. ओके, परफेक्ट. हाँ जी, हाँ जी. ओके, आशुतोष कह रहा है माई आंसर इज करेक्ट. वेरी गुड. यू कम ऑन व्हाट्सएप. ओके, विल मीट अप. Okay, great. Yeah, so very beautiful, guys. Okay, listen, please open your common sense and then answer the question. Okay, these are the recall, bro. I have edited the questions also. It's a recall. The only thought process to share knowledge. So open your brains. Okay, a 4-year-old patient came with decreased weight for height less than -3 standard deviation with mid upper arm circumference less than 11.5. Very clear cut, severe acute malnutrition. SAM is defined as weight for height less than -3 standard deviation with the mid upper arm circumference less than 11.5. Now two things come. There are two types in the SAM. Basically, the fatty baby, the sugary baby, the heavy baby is kwashiorkor, whereas the sukha bacha, the skinny baby is the marasmus. Marasmus has the S. Skinny baby will be marasmus, and kwashiorkor is like a fatty baby. Remember, and multiple times I have told here, SAM is a clinical diagnosis. SAM is a clinical diagnosis. Look at the baby and tell it's a case of SAM. You look at the baby and say, "Sir, मेरे को SAM लग रहा है, sir." So now beautiful, it has told the baby has anasarca and abdominal distension. Please note, tell your beautiful, amazing brains, bro. Abdominal distension can happen in marasmus also, it can happen in kwashiorkor also. You don't dissect or bifurcate the marasmus and kwashiorkor on the behalf of abdominal distension. No, it can happen in both. The abdominal distension can happen in both the babies. Anasarca, periorbital swelling, facial puffiness, whole body, full body swelling. Undoubtedly, kwashiorkor. Okay, this is a kwashiorkor. So, as we all know, marasmus is deficiency of calories plus proteins, whereas kwashiorkor is deficiency of proteins. Very, very important. Okay, so that is why very, very important. Option number B sounds a very good option. Kwashiorkor is due to deficiency of protein. 1000 बार मरने से पहले तुम इतना मार मार के पढ़ाया, ये points ये याद है? Does anyone remember this? Yes or yes, yes. If you say no, send me your phone number. I'll shout on phone. Okay, so has everyone understood? This is a very beautiful question, dude. And last year also this question had come. NEET also this question had come. So it's our duty to revise as much as possible. So in this slide, I have one knowledge I have got it. Number one, SAM is a clinical diagnosis. The fatty baby, anasarca baby, full blown swelling is a kwashiorkor, whereas abdominal distension is not. We are not judging on that. But the skinny baby, the sukha bacha, the skinny baby is more of marasmus. Yes, Dr. Swaraj Suman is beautifully right. That's right. Yeah, and yeah, okay, true. Acha, Sarthak is using extra thing. Sarthak says maybe some mistake in editing, option A, C, D, all are same. Oh, this extra knowledge you have. No, you come on WhatsApp, I'll tell you. Okay, so I just wanted to give you some knowledge. Okay, so this part is done, bro. Okay, next question, please. Yes, very beautiful. Can we please answer in the comment? Extra questions पूछने की बड़ी आदत है मेरे अंदर. Can you please answer in comment this Q2 pie? This Q2 pie is a kwashiorkor or marasmus. This baby kwashiorkor or marasmus. Can you answer in the comment, please? Quick answers, please. Yes, Dr. Shri is right. Monkey-like faces, old men faces marasmus. Yes, that's very beautifully put, my dear. Very good. That's right. Hanji Shubhangi, Osama, Shri, Swaraj Suman, Sarthak Praharaj. What do you think? Exactly. These babies are marasmus baby. Very well put, dear. I want you to be amazing, dude. This is marasmus sukha bacha. This emaciated, this muscle wasting. Typical. See, don't judge me by the abdominal distension. I am trying to make abs, but don't judge me with that. No, don't watch the abdominal distension. Look at the whole skinny appearance of the baby. Next question, please. Yes, very beautifully put. So this is the beautiful bifurcation. This baby is nothing but marasmus, and this Q2 pie is nothing but kwashiorkor. Very, 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 very important. I have two questions to ask you. What is the hypoglycemia cutoff in a case of SAM, and what is the hypothermia cutoff in a case of SAM? Because SAM is like every year topic for NEET and FMG, and even NIMANS and AIMS also. So because India has a lot of SAM babies, so it's good they have a duty to ask about the logical questions. Can you please answer in the comment, please? Shri saying South African baby. Very cute. Very. Should I give you what do you want? Should I give you my power bank? Okay, very nice answer. This is my power bank with a 20,000 mAh battery. बहुत बढ़िया चलता है. भारी बहुत है वैसे. Okay, cute. Shri says 50. Okay, you are dead. अच्छा शुभम says 45. बट तेरे को तो बाहर मारूंगा. इधर ही बाहर आ. Dr. Shubham says in Vikaspuri, I will email you his address, everyone. Dr. Shubham has told the wrong answer. He said 45. Please remember, dear, less than 45 milligram per deciliter is a hypoglycemia cutoff in a case of neonate, whereas less than 54 milligram per deciliter is the hypoglycemia cutoff in a case of SAM baby. That's true. Dr. Shubham ने फिर लिखा less than 45. बड़ी अकड़ है, बहुत अकड़ है. गलत आंसर दें तो बिल्कुल number 1. So please remember, in this slide I have beautifully understood 45 and 54. We have done this multiple times. Less than 45 milligram per dl is nothing but neonatal hypoglycemia cutoff, whereas less than 54 mg per dl is hypoglycemia cutoff in a case of सैम बेबी. हाइपोथर्मिया कौन बताएगा? मान जाऊंगा मैं. हाइपोथर्मिया, हाँ जी डॉक्टर सार्थक प्रराज, अपना सुंदर सा चेहरा दिखाओ और बताओ आंसर क्या है. डॉक्टर आनुम, स्वराज, भीम, स्वराज इज, सुमन इज राइट, भीम करे राइट, श्री राइट, Osama also. Very good, Osama. Very good. True. Hypothermia cutoff. Can you please answer in the comment, please? Very, very important. So I'll repeat again. Less than 36.5. Three things I want you to remember, bro. Less than 36.5, less than 35.5, and less than 35. Okay. Less than 36.5 is neonatal hypoglycemia, number one. Neonatal hypothermia, number one. Very, very important. I'll repeat again. Newborn neonatal hypothermia cutoff is auxiliary temperature less than 35.5 degrees Celsius, whereas less than 35.5 rectal temperature is a hypothermia in a case of SAM, and less than 35 degrees Celsius auxiliary temperature is the hypothermia cutoff again in a SAM. Rectal will be less than 35.5 and less than 35 will be very, very important auxiliary temperature. Has everyone understood this much? Yes or yes? Can we go to the next question? Has everyone understood? Please put a like or a golden heart or a black heart, or just say muh bana ke yes, you understood. Yes, that's true. Okay. True. Okay, let's go to the next question. Bin tere. Okay, now this is a very good question. This is something me and my junior were discussing yesterday. There was also a question. Now that's why I have reframed and made three questions. SAM with dehydration without shock, what's the best fluid of choice? SAM with dehydration with shock, what's the best fluid of choice? And the patient has no SAM, 3-year-old with hypovolemic shock, what is the best fluid of choice? These are very genuine questions and very true questions. Like in a proper SAM topic, we have done it. So what do you think, dear? Sarthak Praharas, black heart. Okay, sounds very attractive. Shri also nice heart. Very good. Cute. Perfect. Now this is something we need to pay attention. Please, you are amazing. You are beautiful. Okay. So please pay this attention. If the patient is not a case of SAM, someone coming to you with a hypovolemic shock or even just a shock, then of course normal saline sounds a very good answer. Yeah, exactly, because my BP is low, I am in shock, I have a feeble pulse, cold clammy skin, my BP not coming, give me sodium, give me normal saline. So normal saline for the hypovolemic shock, we have done this multiple times. NS is the fluid of choice. Whereas now this is important, bro. SAM with dehydration without shock and SAM with shock. Basically, without shock and with shock in SAM is something which is important. In a case of SAM without shock, ORS is the fluid of choice. In a case of SAM without shock, ORS will be a fluid of choice. Very, very important. In a case of SAM with shock, it will be RL plus 5% dextrose. It will be RL plus 5% dextrose or even NS plus 5% dextrose. I'll repeat again. SAM without shock. SAM without shock, very, very important. This slide is important. Treatment, it's the reference is Elizabeth, it's a very important book. Treatment of dehydration in SAM without shock. ORS, very, very important. Please write on your forehead, अपने माथे पे लिख लो. ORS is the fluid of choice, which is given every 30 minutes for the first 2 hours, then alternate hours for 10 hours. Like so much detail, if you don't want to understand, forget it, dude. But just remember, dear, SAM without shock. The patient is a case of SAM. He's not in shock. Someone not in shock actually, but dehydrated, then definitely ORS I would like to give you, because you are not in shock now. Let me give you ORS. It's fine. Whereas very, very important, SAM with shock. Now this is important. Okay, if the patient has the signs of shock, very, very important, then what do you want to give? Remember, okay, in a normal patient, normal in a case of shock, I give normal saline at the rate of 20 ml per kg. We all know that for any patient who is in shock, normal child who is in shock, we can go 20, 20, 20, and we'll give NS bolus at the rate of 20 ml per kg. Then I'll check for the vitals. Vitals not coming proper. Again, I will repeat NS at the rate of 20 ml per kg. Again, check for vitals. Vitals not coming properly. Again, NS 20 ml per kg. Please remember, in a normal child having shock, I will go maximum till 60 ml per kg. Still, my patient BP and vitals are not coming. Then I will say, sir, this looks like a case of fluid refractory shock. फ्लूइड रिफ्रैक्टरी शॉक. क्या आप समझ पा रहे हैं? क्या आपके 250 ग्राम दिमाग में घुस रही है ये बात? ये बहुत इंपॉर्टेंट है. आई विल रिपीट अगेन, वेरी, वेरी इंपॉर्टेंट. जूम करूं मैं, फॉरगेट इट. जो मैं लिख रहा हूं उसको याद करो, बस टेंशन ना लो. वट एवर आई एम राइटिंग, डियर, जस्ट लुक एट, फोकस ऑन दैट. डोंट वरी अबाउट रेस्ट, डोंट वरी. वन सेकंड, लेट मी आल्सो जूम. आई कैन सी वेरी वेल, डियर. It's my Zoom, it's working nicely. Okay, listen to me very carefully. There are two types of shock. A patient normally is in shock. SAM baby is in shock. Someone normally he's in shock, who is not a case of SAM but have diarrhea, dehydration, shock, or the patient is in shock. Normal saline is the fluid of choice. How do you give? 20 ml per kg bolus. Bolus. Someone is dying, straight away you'll give normally. BP not coming, again gives second bolus of 20 ml per kg. Vitals not maintaining, again you give 20 ml per kg. Maximum, sir, how much NS we can give to a child? You can give 60 ml per kg. If after 60 ml per kg still my patient's vitals not coming, what do you call that, baby? You will call that fluid refractory shock. मतलब fluid देने से वो बच्चे का shock improve नहीं हो रहा. उसके बाद हम क्या करेंगे? उसके बाद हम inotropes पे जाएंगे. After that we'll come on inotropes. Okay, dopa, dobuta, ADR and all that. Then it is more bifurcated into warm shock and cold shock and all that. This was the case of normal patient coming into shock. One extra beautiful knowledge I want to we should know is, if a SAM baby is in shock, bolus you will give, number one, how much bolus you'll give? In a normal patient 20 ml per kg, but in a SAM baby we give at the rate of 15 ml per kg. That is the first thing, because SAM baby has the baby can go to congestive cardiac failure or fluid overload, because the baby is already too much of kind of immunocompromised. So 15 ml per kg bolus will give. And what bolus you want to give? Very, very important. Either you give me ringer lactate plus 5% dextrose, that is one thing you can give me, or very important, half normal saline with 5% dextrose. Very, very important. Okay, half normal saline plus 5% dextrose is nothing but 0.45% of DNS. I'll not go too much in detail, but there's a कांच की बोतल आती है हमारे यहाँ. There's automatically a bottle there. It's written over there, 0.45% DNS. So one very, very important. Yeah. Okay. Yes. Acha, you know this already. Okay, that sounds good. Okay, perfect. Yeah. Yeah. Okay, Sarthak, delete that message, bro. Okay, so that's what. So this beautiful part we have understood, because many people were having this issue. Okay, many of us have written the normal saline as an answer. So this is one beautiful point you should know. That's it. Okay, I'll go to the next one. Let's go to the next session, please. Yeah, the beautiful, yeah, a beautiful quote, very, very important. A beautiful quote says, "You can't cross the sea merely by standing and staring at the water. You can't cross the sea merely by standing and staring at the water." Because you have to work hard, you have to work hard, you have to work hard, bro. You can't cross the sea merely by standing and staring at the water. You have to face these questions, you have to update your knowledge, because there is always a room for improvement. That's why. Now this is a very good question. A 5-year-old boy. A 5-year-old boy, mother complains the baby is not growing as compared to the other siblings. Good thought. A good thought. It's a recall question, okay? ऐसा question नहीं आया था, ये मैंने बनाया थोड़ा सा. A 5-year-old boy, mother complains the baby is not growing as compared to other siblings. Okay, fine. On further evaluation, the child height was less than third percentile. Very good question. The child's height was less than third centile. This is nothing but known as short stature. This is nothing but known as short stature. इतना तो समझ में आता है. And the bone age was less than the chronological age. Bone age was less than the chronological age. Very, very important. Bone age was less than chronological age. Parents' height was also short. Now, this is very important. Bone age was less than the chronological age, and also the parents, the parents' height was also short. What is your best interpretation? Can you please answer in the comment, please? Yes, Dr. Shubham, मेरे प्यारे भाई, what do you think? Now please remember, तीन बातें होती हैं. There are only three things we must remember. Bone age is equal to chronological age. Bone age is less than chronological age, very, very important. And bone age is more than the chronological age. Usually, yeah, exactly. If the bone age usually is equal or less than chronological age, but less than height age also, that is known as familial short stature. Very, very important. Remember this, okay? There are two types of short stature. One is familial short stature and one is constitutional short stature, or you say constitutional delay in growth and puberty, CDGP. Constitutional delay in growth and puberty. Now this is something very important, okay? Bone age is equal to chronological age, but less patient है. बिठा दो फिर उनको. 9:30 बुलाया था मैंने. बोल दो 9:30 15 मिनट. हाँ बोलो, बच्चे साथ आए हैं, फिर वो कैसे करेंगे, पूछ लो. When the bone age is equal to chronological age but less than the height age, you must think of familial short stature. But if the height age is normal, then you must think of CDGP. Please remember. Remember, there is two type of short stature we have always discussed. One is constitutional short stature, one is familial short stature. In the constitutional, very, very important, I will have a normal vaginal delivery. I'll be born with a normal weight and a normal height. What will happen by the 1 year of life, my weight and height will fall down. Very, very important, okay? And see, and the patient's whole graph, the black dots basically are running parallel to the 50th centile. This is the dear 50th centile, okay? Normally I should be on this red line, but I'm below the red line till I'm like a 14 year of life. But my target height, very, very important, my target height or final height is normal in a case of CDGP. Whereas in a case of familial short stature, my target height or final height will also be less. This is like a very, very important point. Many of us don't really understand this point. So constitutional short stature, very important. This is the most commonest cause of short stature. What happened in constitutional? Okay, you're reading this for the first and last time. Okay, my weight and height are normal at birth. Okay, then what happened by the end of 1 year? There is a decrease in my weight and height in constitutional. Then what happens? I run parallel the normal. My weight and height run parallel the normal throughout 6 to 11 year of life. But at the end of adolescent, my weight and height accelerates, and that is why very, very important, in a constitutional short stature, final adult height will be normal. Parents' height are also normal, whereas in CDGP, parents' height will be less. Parents' height will be less. Very, very important. Okay, parents' height will be less, and that is why in this case the parent height was normal. That is why I was more touching towards the familial short stature. I was more touching towards the familial short stature. That you should know. Okay, a newborn baby born through cesarean section did not cry immediately after birth. On further evaluation, heart rate was less than 60. What is the next best step? Again, it's a recall question. I have made 2-3 questions on this. So Tell me what is the best answer. We have done this 1 million times. Can you answer in the comment, please? Anyone having heart rate less than 60, what will you do? Chest compression and bag and mass ventilation. Chest compression and bag and mass ventilation is what we do when the heart rate is less than 60 beats per minute. Very important. What do you think? Yeah, so heart rate less than 60, very, very important. Please remember, Dr. Shubhangi, alone chest compression nahi karte. Alone to hota hi nahi hai, remember. Alone chest compression is never done. Either you do a bag and mass or you do a chest compression and bag and mass ventilation. Please remember, when the heart rate was less than 100, I will do bag and mass ventilation. If the heart rate is less than 60, I will do chest compression plus bag and mass ventilation. Alone chest compression will never be an answer. Alone chest compressions will never be an answer. Okay. And very, very important, when do you give adrenaline? Very beautifully. I hope you all know that. When the heart rate was less than 60, I did chest compression and bag and mass ventilation for 60 seconds. And then again, I checked the heart rate. It was still less than 60. Then I will touch the adrenaline. Has everyone understood this one? This is important. It's a beautiful knowledge. We must appreciate this. When the heart rate is less than 60 of a baby, you do chest compression and bag and mass ventilation for 60 seconds. You again, very importantly, auscultate. If the second time heart rate is less than 60, you give adrenaline. Very, very important. Sarthak kare, yes sir, Mia Bivi Hamesha Saath Saath. Yes, that's right. Perfect. Very good. Now there's one more recall question actually. This was another recall question. One student had told me, what is the indication of starting chest compression and bag and mass ventilation neonatal resuscitation? Someone said this was a recall question, one of my FMG junior. So what do you think? What is the Dr. Shubham? What is the best answer? What is the indication of starting chest compression and bag and mass? Everyone knows. Oscar को भी पता है कि heart rate less than 60 होगा तो chest compression और bag and mass चालू करेंगे. Perfect. Next question, please. Okay. Next question. Yeah, we have 9 minutes to go. 9:30. I have an appointment with the patient. He'll come. How much percentage of oxygen should be given for a newborn baby initially in neonatal resuscitation if the baby is having apnea or heart rate less than 100? Now, this is a very good question. This was a tongue twisting question. Many have written 20%. Acha, option dekho, meri himmat hai. So, in one option, the option is 100%, and option number D will be none of the above. None of the above. So, what do you think, guys? What will you write and come? In how much percentage of oxygen should be given for a newborn baby initially is the word, in neonatal resuscitation if the baby is having apnea or heart rate less than 100? Now very, very important, when the heart rate is less than 100, हम सबको पता है कि हम bag and mass चालू करते हैं. When the heart rate is less than 100, हम सबको पता है कि हम bag and mass करते हैं. Now bag and mass also multiple things are there. Either I can use the bag and mass with the reservoir and also with the oxygen. Let me show you a beautiful picture first. As we all know, this is a beautiful bag and mask. This is the mask. This is the pop-up valve. This is a beautiful self-inflating valve. This is the oxygen tube, so important. And this is the reservoir. This is the reservoir. Now you should know, basically, if you are having the reservoir and also the oxygen you are giving, and then you are doing the bag and mask, कितने प्रतिशत आप oxygen बच्चे को deliver करते हैं? This is the now thought of the exam question. Please remember, very, very important. Remember, see, AMBU without reservoir, without oxygen obviously will give 21% oxygen, means room air. I'm doing a bag and mask. There is no reservoir. There is no oxygen tube. It is just the bag and mask. How much oxygen you're giving? 21%. Number one. Then I'm having the bag and mask, AMBU bag I'm doing, plus there is a reservoir, plus there is oxygen. Now then, how much you're doing? Any idea in the comment section? Yes, exactly. So the answer will be 100%, right? AMBU bag and mask with reservoir with oxygen, then obviously you'll do 100% oxygen you're giving. Okay. And if you have a bag and mask, if you have a reservoir but there is no oxygen inlet or no oxygen pipe connection, then how much oxygen you are giving? The beautiful answer is 40%. So one thing I have understood, 21%, 40% and 100%, ये तीन बातें मुझे समझ में आती हैं. I'm doing a bag and mask, there is a reservoir, there is an oxygen connection, both are there, then obviously I'm giving 100% oxygen. There's a bag and mask, there is no reservoir, there is no oxygen inlet, then of course obviously जो भी room air होगा 21% oxygen I'm giving. And very, very important, if there is a reservoir but no oxygen inlet, then it will be a 40%. So that is why in this question, very, very important, the answer for this question will be 21%, because how much percentage of oxygen should be given for a newborn baby initially in neonatal resuscitation? So if the heart rate was less than 100, when you start the bag and mask ventilation, you usually do the bag and mask in the room air. Because later if the patient is still gasping or still apnea is there, then you connect basically the oxygen tube. So that is why the best answer will be 21%. You all were amazingly right. A quick motivating quote, 5 more minutes that this class is beautifully over. दिल का साफ होना जरूरी है, दिल का साफ होना जरूरी है, क्योंकि कोई वादे करके भी साथ नहीं देता है, तो कोई बिना वादों के भी जिंदगी भर साथ निभाता है। जैसे कि आप लोग, जैसे कि ओसामा, जैसे कि शुभांगी, जैसे कि सार्थक प्रहराज, जैसे कि all the amazing people like Jalpit, Swaraj, Suman, and even Ashutosh. So that's what. So this is a very beautiful quote. Can we have the next quote, please? Has everyone beautifully understood? Yes or yes, yes. 4 more minutes and this class is over. Again, a very easy question. 2 days old neonate came with complaints of distress, frothing of secretion, dribbling of saliva, and mother having history of polyhydramnios. Okay, according to the X-ray shown below, what is the best possible diagnosis? So if I don't even show you the options, but neonate have with distress, frothing of secretion, dribbling of saliva, history of polyhydramnios. One student had told this word was there. One student had told polyhydramnios word was not there. So even someone having distress, frothing of secretion, and X-ray showing this is a very classical. Yes, exactly. Yeah, yes, Dr. Sarthak Praharaj, you're right. So this is a very beautiful X-ray of tracheoesophageal fistula, because I can beautifully appreciate the coiling of the nasogastric tube. There's a coiling of the nasogastric tube. You all know that. Yes, Dr. Osama, you're very right. So coiling of the NG tube we all see in a case of TEF. Even one more beautiful classical picture. So in this class, I want you guys to appreciate knowledge, take some message at home, someone having coiling of the nasogastric tube, repeatedly frothing of secretions and all that, you must think of TEF. So that is why the best answer for this question will be, of course, tracheoesophageal fistula. This is not a hyaline membrane disease. If the hyaline membrane disease I would wanted to choose, they would have written the baby is having white out lung, something like that. Then the baby would be a preterm, something like that. That the question should be a preterm baby with white out lung with distress. Then it's more touching to what HMD, hyaline membrane disease. And the other word of HMD is nothing but RDS, respiratory distress syndrome. And why it is not a transient tachypnea of newborn? Usually it is a term baby, and usually they are LSCS born. So there is no LSCS over here. It's something frothing and distress and all that. The story goes somewhere else. Last 3 minutes, then this class will be over. A quick question on TEF. Can you please answer in the comment? Dr. Suman, what is the name of the classification for TEF? Yes, Dr. Sarthak, Dr. Anum, Ankit, Shubhangi. Yes, yes, yes. You are very right, Suman. Very good, very good. Last 3 minutes, the patient is already there in my another room. So we have to go then. Exactly. The name of the classification for TEF is nothing but very, very important. Gross classification. Gross classification is the name of the classification for TEF. किसने बताया? Okay, okay. Osama says NADA's criteria. Okay, NADA's criteria is for diagnosing a congenital heart disease. For diagnosing the presence of a congenital heart, we have the major and the minor criteria. That will be a NADA's criteria. One major and two minor. Gross classification is the name of the classification for tracheoesophageal fistula. This part is done. Now coming to the next question. The next question we have is 1 second. Yes, very easy. Okay, nice. This is the last question, guys. 2 more minutes and this class is over. A 4-year-old boy with periorbital swelling, facial puffiness, and pedal edema who was on steroid therapy. This one line only has given me everything. A 4-year-old boy, periorbital swelling, okay, facial puffiness, okay, pedal edema, okay, was on steroid therapy. So what do you think? I think we are talking about nephrotic syndrome, of course. Nephrotic syndrome, only the patient comes with anasarca, we all know that. And what do you call? Yeah, anasarca. And for the first episode of nephrotic syndrome, we give prednisolone. We all know that. According to body surface area or according to 2 mg per kg per day. So this इतना तो समझ में आता है कि we are talking about nephrotic here. On further evaluation in the electron microscopy, the patient had effacement of the food process of the podocytes are seen. This one line is obviously a case of, we all know that in general, the patient, we are talking about minimal change disease. The minimal change disease only has a electron microscopy appearance of effacement of the food processes. Yes, Dr. Vijay Raghavan, very good, perfect. Patient was having proteinuria was more than 40 milligram per meter square per hour. More than 40 milligram per meter square per hour is nothing but nephrotic range proteinuria. You know na, the patient of nephrotic syndrome basically has a what you called क्या बोलते हैं उसको nephrotic range proteinuria is nothing but more than 40 milligram per meter square per hour. So the whole thing is like literally telling everything. The whole theory topic is there only. The probable diagnosis is obviously nephrotic syndrome. Obviously nephrotic syndrome. So nephrotic will be a better answer. And of course, minimal chain disease is the most common thing happen over there. Why it is not nephritic? In a beautiful thing, we all know that if it was a nephritic syndrome, there should be some hypertension. There should be hematuria, not like nephrotic will have a massive proteinuria, whereas the patient will have a hematuria in nephritic. RBC cast in children, there should be some URTI, LRTI, and then the patient should have hypertension or hematuria. So hematuria, hypertension, RBC cast, everything happens in nephritic syndrome. And the most commonest cause of nephritic syndrome in children is nothing but PSGN. What is PSGN? Post streptococcal glomerulonephritis. So this was one more question. This was another question on nephritic they had given. One question was minimal chain disease nephrotic syndrome, and one question was nephritic syndrome. That finishes this amazing class. Has everyone understood this much? Yes or yes, please let me know. 1 hour is over and enough of studying today. Both हो गया आज का, खत्म कहानी. Thank you so much everyone for this beautiful participation. Before leaving, we have a beautiful quote in Hindi which says, जो बदल जाए वो यार कैसा, जो बदल जाए वो यार कैसा, जो छोड़ जाए वो साथ कैसा, सब कहते हैं प्यार सिर्फ फिर से हो जाता है, जो फिर से हो जाए वो प्यार कैसा. So I think that's you have understood this beautiful thing. जो बदल जाए वो यार कैसा, जो छोड़ जाए वो साथ कैसा, सब कहते हैं प्यार फिर से हो जाता है, जो फिर से हो जाए वो प्यार कैसा. Thank you so much everyone for this beautiful participation. I hope you have understood some little titar you have understood in this beautiful class. In the next segment, once we're gonna have, I'm gonna talk about other important thing. There was a question on measles they had asked in the other question, and in the next segment I'm gonna talk about it because already 1 hour is over. And also there was a question on what you called about what is ABCDE in a case of pediatrics emergency. This was a DNB question 3-4 months back. Same question had come. The DNB mein I took a class there and it was a question, what is D in pediatric emergency, like that. So these all questions we're going to talk in the next class. Then the question was there on vitamin A and bone jog disease, but I'll not cover in this. In the next segment, we're going to talk about it. Thank you so much, everyone. Please take care and bye bye. Study well. Life is beautiful. Okay. Bye. Take care. Bye bye. Bye bye. Take care. Happy.